Kathleen, and I'm a student with McKendree University, and I will be doing a PowerPoint on proper hand washing.
Hi, Kathleen.
And you have handouts. The definition is the act or activity of washing one's hands. General information, the CDC in 1975 and 85 published guidelines on proper hand washing. In 2002, they recommended using alcohol-based hand sanitizers between patient contacts with no visible soiling on your hands. They also recommend no artificial nails to be worn due to the harboring of germs underneath the fake nail. Studies prove that educational programs increase hand hygiene compliance, and as upper healthcare providers, doctors and MPs need good hand washing practices to show support staff the proper techniques.
Oh, I just read. I've read. 80% of exposure to germs occurs through touch.
Good hand washing prevents sickness and decreases the amount of antibiotics used, thus decreasing antibiotic resistance. And also 30% of diarrhea-related sickness and 20% of respiratory infections can be prevented through proper hand washing. It's also the single most important, simplest, and cheapest way to reduce house-acquired infections, decreases the prevalence of MRSA on hands, and then once again, your upper healthcare providers need to set an example for their support staff. When you should wash your hands: before, during, and after food preparation, before and after eating, of course after using the bathroom, before and after caring for the sick, after blowing your nose, coughing, or sneezing, and if your hands are visibly soiled. And then, like for clinic, it's after reviewing patients or obtaining specimens. How to wash your hands: you remove your jewelry, you wet them with clean hot water, lather, you scrub, like backs, all the crevices. Then you rinse with clean water, dry on a clean paper towel, and then turn off your faucets with a clean, dry paper towel.
Is it true that happy birthday or row your boat is the appropriate length of
Yes.
time?
Yes. Row your boat 3 times.
Okay.
And what about hand sanitizers? This is a substitution for when soap and water is not readily available or when your hands are not visibly soiled. It comes in gel, foam, or liquid, and it's convenient to carry in your pocket. And when and how to use hand sanitizer is between patient contact, before procedures, before Foley cath, IVs, or blood draws, before applying sterile gloves, and you use at least a dime-size amount. Rub all over your hands for at least 40 to 60 seconds. Or row your boat 6 times. And just a few questions, see if you were listening. True or false? Hand washing is the simplest way to decrease the spread of germs.
True.
True or false? Proper hand washing should be a priority of healthcare staff.
Very true.
True or false? CDC does not recommend using alcohol-based hand sanitizers. True or false? Hand washing should be at least 20 seconds long. True. And last one, true or false? Hand sanitizer may be used on visibly soiled hands.
No.
Very good. Thank you for your attention. And now
these things in the hospital?
we can wash hands and eat donuts.
It's interesting technology.